I'm joined by the President of the Royal Australian College of General Practitioners, Dr Nicole Higgins, who is a GP in Mackay in North Queensland. Dr Higgins, thank you very much for joining me. Can you start by telling me why you're concerned about this move?
Thanks, Fiona. I guess for people, it is like getting a plumber to come into your house and do the work of the electrician and wire it. We're trained differently. And as a GP, we're trained to diagnose and manage illnesses, and pharmacists are trained to be the experts in dispensing medicines.
So under this plan, pharmacists would be able to treat ear infections, wounds, nausea, gastro, acne and muscle and joint pain, and that would kick in from 2026. Is there anything on that list that you would be comfortable with pharmacists seeing to instead of a doctor?
So dispensing a medicine or prescribing a medicine is often the easy part, and people present with symptoms that don't present with a diagnosis. So nausea could actually be a heart attack, or it could be a cancer. There are lots of ear infections, for example. Most ear infections we don't treat with antibiotics. So our concern is more around that, at a time when we're trying to reduce the amount of antibiotics in the world, is one of the biggest health threats, we're actually going to be increasing the prescribing and the use of those types of medicines.
We have already seen this happen in some areas. Pharmacists are now able to give prescriptions to women with urinary tract infections. How do you feel about that? Are you aware of any potential negative outcomes from that move?
Yeah, so I'm where the original pilot was, and what we've found is that UTIs 50% of the time they're not. It could be that they could be a cancer, or it could be a sexually transmitted infection. And we're finding that we're getting antibiotics prescribed. And as I said before, antibiotic use is one of the biggest threats to our global public health, and we should be restricting them and not increasing them.
Now, of course, the aim of the plan is to ease pressure on GPs and hospitals. Do you believe that it will have that effect?
So trying to explode that myth a little bit with GPs, what we've seen in the UK is it's actually increased delayed presentations and misdiagnosis. So we need to make sure that people do what they're best at doing and what they're trained for. And, this has been done to address access. We know that Macca's is easy access, but it's not necessarily healthy for you. So it's a bit of a false economy. And we need to make sure that we invest in the system from the bottom up, not just keep, shifting the deck chairs around.
Yeah, so just to go into that more, what changes do you think that we need to see to address these pressures on GPs and hospitals?
So with respect to access, the ABS data actually says that 4 out of 5 people can get into their GP within that first 24 hours if they need to. And we need to make sure that we invest in the foundations of the healthcare system, and that is general practice and primary care. And we know that the funding in that has been dropping and more has been going into hospitals. So that's our call to the government: invest more in general practice and primary care, keep people well and keep people out of hospital.
And I guess what's your message to patients, to people who might be thinking of going to see a pharmacist to get treated for one of these conditions when this comes into effect?
Look, 9 out of 10 people see their GP every year. If you've got something that you're concerned about, touch base with your practice and your GP, and keep seeing your pharmacist for your medicines. That's what we're trained for, and we work very, very closely together. However, we can't start fragmenting care and splitting the system off. We need to make sure that we have continuity and we work together.
Thank you very much for joining me. That's Dr Nicole Higgins, who is President of the Royal Australian College of General Practitioners.